Hello, good morning. Today we are going to discuss the Norma lateralis. It's nothing but what are the bones we can see in the lateral region. From our lateral point of view, what are the bones we can see? This is the Norma lateralis. Now coming to the what are the bones we can see in the Norma lateralis. First we will go from upside to downside. We can see this is the frontal bone and this is the parietal bone and this is the temporal bone and occipital bone backside we can see, and also we can see this is the sphenoid bone and zygoma and nasal bone. Here we can see this is the nasal bone, and also we can see maxilla and mandible. Now we will talk about the what are the sutures present in Norma lateralis. We can see this is the coronal suture between the frontal bone and the parietal bone. You can see this is the coronal suture, and this is the squamous parietal suture between the parietal bone and the squamous temporal bone, and this is the spheno-squamous suture between the sphenoid bone and squamous temporal bone. And also posteriorly we can see this is the lambdoid suture between the parietal bone and the occipital bone, and just inferior to that we can see the occipito-mastoid suture between the mastoid process of the temporal bone and the occipital bone. And we can also see this is the suture present between the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. We can call it as a zygomatico-temporal suture also we can call. And also we can see suture between the nasal bone and the frontal process of the maxilla bone. Now we will discuss what are the features present in the Norma lateralis. We can see temporal lines which are going upwards and backwards and downwards, and zygomatic arch or zygoma, and mastoid process of the temporal bone, and styloid process, and temporal fossa, and infratemporal fossa, and pterygopalatine fossa we can see in the Norma lateralis. Now we will talk about individually the features of the Norma lateralis. In that, first we will discuss about the temporal lines. There are two temporal lines, superior temporal lines and inferior temporal lines. Superior temporal lines goes upwards and backwards and fade away, and inferior temporal lines goes upwards, backwards and comes downwards on the supramastoid crest of the temporal bone, and the supramastoid crest of the temporal bone attaches posterior root of the zygoma. Here the line comes like this and it attaches the crest of the supramastoid. Thank you. Now we will discuss about the zygomatic arch or zygoma. We can see this is the horizontal arch bar or horizontal bone which is called as a zygomatic arch or zygoma. It is formed by this is the zygomatic process of the temporal bone, and this is the temporal process of the zygomatic bone. And also we can see this is there is a suture which goes or which passes downwards and backwards like this in an oblique pattern it's running. This is the zygomatico-temporal suture, and we can see the posterior end of the zygomatic arch. Here it is connected to the squamous temporal bone by the anterior and posterior roots. The posterior root is located lateral to the articular fossa. Here we can see this is the articular fossa. The posterior root is located laterally to the articular fossa, and also one more anterior root which is located medial to the articular fossa. We can see here, this is the medial to the articular fossa. We can see one tubercle which is present on the lower border of the zygomatic arch. This is the articular tubercle which is present on the lower border of the zygomatic arch. The above the zygomatic arch, the area is called as temporal fossa, and that is filled by the temporalis muscle. And just above the temporalis muscle, the temporal fascia, the temporalis fascia attached to the upper border of the zygomatic arch, and masseter muscle attached to the lower border of the zygomatic arch. And now we'll talk about one more feature of the Norma lateralis, that is the external acoustic meters. You can see this is the external acoustic meters, which the anterior, this is the anterior and inferior border, which is formed by the tympanic plate. We can see this is the tympanic plate. This is the anterior and inferior border, and little bit posterior borders are formed by tympanic plate, and the superior and posterior borders are formed by squamous temporal bone. Now we'll talk about mastoid process, which is located just behind the external acoustic meters. We can see this is the external acoustic meters. The mastoid process articulate with the two bones. One is, this is the inferior part of the parietal bone, and here we can see the occipital squamous part of the occipital bone. The suture we can see in between the mastoid process and the occipital bone, squamous part of the occipital bone, that is occipitomastoid suture. We can see this is the occipitomastoid suture, and this is the, here we can see parietomastoid suture between the inferior part of the parietal bone and mastoid process. And one more suture we can see, this is the lambdoid suture come and meet this both suture. We can see this is the meeting point, and this area is called as the asterion. There are asterion where the three suture meets: parietomastoid suture and occipitomastoid suture and lambdoid suture. Now we will talk about one more feature, that is styloid process. We can see this is the styloid process, which is thin, slender, and it runs downwards, forwards and medially, and the tip of the styloid process sometimes covered by ramus part of the mandible, and the base of the mandible covered by tympanic plate. Here we can see this is the tympanic plate. It is the base is covered by the tympanic plate. Other three features like temporal fossa, infratemporal fossa and pterygopalatine fossa we will discuss in some other chapters like muscles of mastication and all. Now we will talk about the attachment of the normal lateralis. Here we can see this is the temporal fossa, and the temporal fascia is attached from the superior temporal line and the area between superior and inferior temporal line, and attached to the outer and inner lip of the upper border of the zygomatic arch. And below that temporalis fascia, the muscle which is temporalis muscles will attach, and temporalis muscle arises from the whole temporal fossa, and just beneath the temporalis muscle the deep temporal vessels present. middle temporal vessels shows the markings on the temporal bone just above the external acoustic meatus. As we discussed earlier, the medial border or lower border of the zygomatic arch gives origin to the masseter muscle. The masseter muscle and the temporalis muscle we can feel by clenching our teeth like this. By clenching we can feel the masseter muscle. And muscle attachment of the mastoid process are sternocleidomastoid muscle, it goes like this, and splenus capitis, it will come like this, and another muscle longissimus capitis. This is the muscle attachment of the mastoid process. And one more muscle, that is posterior belly of the digastric muscle also attached to the mastoid process. One more muscle, the posterior belly of the digastric attached to the mastoid notch, and also we can see one groove is present here. This is the groove is present, that is for the occipital artery. Now we will talk about the last part, which is structure passing through the foramina and fissure of the Norma lateralis. You can see here just in front of the base of the mastoid process there is a tympanomastoid fissure, which the auricular branch of the vagus nerve will pass through the tympanomastoid fissure. And from the mastoid foramina, we can see this is the mastoid foramina. What are the structure passing through the mastoid foramina? Those are one is meningeal branch of occipital artery and the emissary vein which connecting the sigmoid sinus through the from the posterior auricular vein. And another one foramina, that is zygomatico-temporal foramina, which transmit the zygomatico-temporal artery and vein and also nerve. Thank you.